I was born with congenital heart disease, and so from birth I saw cardiologists fairly frequently. And my own cardiologist was this wise old balding man with white hair and bow ties and the most gentle disposition. And I remember so clearly going to his office, and the tiles on his floor had Looney Tunes, Bugs Bunny and Daffy Duck. And you went into a room based on what the cartoon was. And he talked to me not like there was something wrong with me, but like I was a kid. And he was just a personal hero. And I wanted to be just like him.
What has been the most challenging aspect of being a physician and having a disability?
Access. And by access, I don't just mean, automatic doors and wide, doors in the toilets and raised bars. I'm talking about access to my patients, about moving things out of the way when you enter a room so you can get to a patient's bedside, about not having to roll over their IV tubing and their oxygen tubing or their ventilator, circuitry to get to a patient's bedside, about accessing a baby who's up in a very high warmer to be able to examine a neonatal in the NICU. That's probably the big one. As far as being deaf, it's a challenge to find somebody to come in that I trust to be able to listen to heart and lungs for me and know that what they're hearing is accurate. I'm blessed with a phenomenal interpreter who can interpret to me the sound of voices and the sound of speech that my patients are making, that help me diagnose what their speech or language difficulties may be. That's an unbelievable blessing to have that, because hearing how somebody's talking, hearing how many breaths they have to take between words, that's all such crucial information that you lose by being deaf. And I've been very fortunate that OSU has been amazingly supportive in providing me the interpreters that I need and going out of their way to make sure that 90% of the time I'm working with Alicia. Because it's a steep learning curve to do what I do. And it's not just like when a deaf person goes to a doctor, it's very different interpreting. When she has to interpret a physician talking to another physician, they don't teach you that in interpreting school. That's just a whole new level. And it takes an amazing amount of intelligence and patience and willingness to admit, I don't know what the hell you're talking about, to be able to interpret that accurately. And these are life and death decisions we make, and if she misinterprets something to me, that can have huge consequences on patient care. The reward is the hug at the end of a visit. It's a letter of appreciation. It's this envelope full of high school graduation pictures and prom pictures that families send me because I'm part of their family now. It's the child who, after they get their Botox shots and have finally stopped crying, come up and say, "Thank you, Dr. Kaitz." I mean, that beats a paycheck any day. And that doesn't matter whether you're disabled or not. And that's just, you've done something to help somebody else, to make an impact on their life, or to inspire somebody, or to give them the you cans instead of everybody else giving them the you can'ts.